Welcome to Module 10, Auditing. In this module you will learn the principles of auditing, the types of audits, roles and responsibilities, and the audit process steps. Note that there will be a quiz at the end of this module. You must score at least an 80% to pass, and the quiz can be retaken as many times as needed. The requirement to audit can be tied back to Clause 8.2.4 of ISO 1345. Auditing requirements are also defined in 21 CFR Part 820.22. Additional information can be found in the auditing standard ISO 19011. This standard is recommended for guidance and does not require any certifications. The objectives of auditing are to ensure that the QMS is effectively implemented and maintained and conforms to planned and documented arrangements, the requirements of standards, the organization's own requirements, and any applicable regulatory requirements. Paragraph 3 of Clause 8.2.4 discusses running an internal audit program, or a plan or system for auditing. Audit frequency should not be based solely on the calendar. When determining the frequency of audits, the standard says to take into consideration the status and importance of the processes or area being audited, as well as results of previous audits. This means that higher risks should be audited more frequently than those of lower risk. Risks to the organization to consider include results of previous internal or external audits, customer complaints or supply chain issues, non-compliance with legal requirements, and/or significant changes to the auditee or its operations. The selection of auditors and conduct of audits shall ensure objectivity and impartiality of the audit process. This means that the auditors should not be able to audit their own work. Following audits, management of the area audited must ensure that the necessary corrections and corrective actions are taken without undue delay, and verification of actions taken and reporting of verification results. The following principles provide the foundation for the auditing program. Integrity, which is performing the audit with honesty and without personal bias. Fair presentation, which is reporting truthfully and accurately, and also reporting any unresolved disputes. Due professional care, which is exercising diligence in accordance with the importance of the task and the confidence placed in you by the audit client. Confidentiality, which is exercising discretion in handling sensitive or confidential information acquired in the course of the audit. Independence, which is acting in a manner that is free from bias and conflict of interest. Evidence-based, which means the audit findings and conclusions are based only on objective evidence that is verifiable. And lastly, risk-based, which is considering the risks and opportunities in planning and conducting audits and focusing the audits on things that matter and that are most significant to the audit client. There are three primary types of audits: third-party audits, second-party audits, and first-party audits. Third-party audits are conducted by our external and partial party. These include certification and regulatory audits. Second-party audits are optional and are usually when the customer audits an external provider, such as a supplier. These types of audits are not mandated by ISO 19011 or by the individual QMS standards. Also, there is first-party audits, and these are internal audits conducted by the organization on itself. There can also be a gap analysis audit or a pre-audit, and this is done at the beginning of the certification journey to assess what is currently in place against the set of requirements of the standards. Let's now discuss the different roles and responsibilities of the audit program. First, there is the manager of the audit program. This individual oversees the audit program and maintains audit schedules for the organization. This individual also initiates each audit and defines the objectives, scope, and criteria for each individual audit. The objective is the reason for doing the audit, and there can be more than one. For example, the objective could be to determine the conformance to ISO 1345 or to determine the cause of a manufacturing process defect. The scope is the boundaries of the audit. For example, the scope can be the quality management system or the corrective action process. The criteria are the requirements against which you will be auditing. For example, ISO 1345. Typically, the management representative or quality manager is the manager of the audit program. This individual should have the competence to manage the audit program and its associated risks and opportunities. Next, we have the audit team leader, also known as the lead auditor. The lead auditor is assigned to oversee an individual audit. The lead auditor has the knowledge and experience to personally conduct the audit and ensures that the audit objectives are completed effectively and within the allotted time. The audit leader also completes and signs the audit report. At times, the audit team leader may also have audit team members. Audit team members work under direction of the lead auditor to carry out their assigned responsibilities. They assist in conducting the audit and may not have sufficient knowledge or experience to be a lead auditor. They work independently and collect and analyze audit evidence and document their audit findings. Auditors in training may be included in the audit team, but under the direction of an experienced auditor. The auditee is the organization or parts thereof being audited. This includes any members of the management interviewed during the audit. The auditee assists in achieving the audit objectives and provides access to areas and documentation included in the scope of the audit. The auditee acknowledges and takes corrective actions on the audit findings. The auditee also attends opening and closing audit meetings. An observer is an individual authorized to accompany and observe an audit. This can include representatives of customer organizations, auditors in trainings, and members of the quality department acting as a recorder. Lastly, we have the audit client. The audit client is the organization or person requesting the audit. For internal audits, the audit client may be the manager of the audit program. For external audits, the audit client may be regulators or customers, including potential customers. The audit client determines the need for and initiates the audit. They also pay for the audit and own the audit reports. The audit client determines the audit team for internal audits or auditing organization for external audits. Hence, the auditors are working for the audit client. The audit client must authorize any proposed changes to the audit objectives, scope, etc. during the audit. Let's now discuss the audit process steps. First, you start by initiating the audit. This includes establishing contact with the auditee and determining feasibility of the audit. With establishing contact, you also want to establish or confirm the objectives, scope, and criteria of the upcoming audit and request any relevant information for planning of the audit. If the audit is not feasible, the team leader should negotiate with the audit client for additional resources. Next, we need to prepare for audit activities. This includes performing documentation review and audit planning. Audit planning should have a risk-based approach. The audit plan should address the audit objectives, scope, and criteria, the locations, dates, and expected time and duration, meetings with the auditee's management, the need for a tour of the auditee's facilities, and the audit methods to be used, such as on-site or remote, and the extent of the audit sampling. Audit planning also includes assigning work to the audit team and preparing work documents. Although not required by ISO 19011, an audit checklist is one of the most valuable tools auditors use during an audit. For internal auditing, standards checklists are often created by the organization for different areas and processes. Next, we begin to conduct audit activities. This includes assigning guides and observers, conducting the opening meeting, communicating during the audit, ensuring availability of audit information, and collecting and verifying information. The opening meeting is held with the auditee's management and the audit team to kick off the audit and is conducted by the audit team leader. Audit activities also include generating audit findings, determining audit conclusions, and conducting a closing meeting. Next, we must then prepare and distribute the audit report, complete the audit, and perform audit follow-ups as needed. Let's now discuss how to audit. So during audits, The auditor goes through the requirements one by one and seeks evidence of conformity to the requirements. For each requirement, the auditor has an audit finding of conformity or non-conformity. During the audit, evidence related to these requirements should be collected using sampling methods. Again, these sampling methods should be risk-based. Only information that is verifiable should be accepted as audit evidence. For example, word of mouth is not considered evidence. There are 3 overall questions that you are trying to answer during an audit. First is, have they said what they do? This means, do their defined or documented processes accurately express their work activities? Next, have they done what they said? This means, do the observed and recorded practices show conformance with the stated procedures? And then lastly, have they done it well? And this is also related to effectiveness. To what extent are planned activities realized or procedures followed and planned results achieved? If nonconformities are found, there is a general way to write them. This includes recording the applicable requirement from the audit criteria and also recording the audit evidence to support the nonconformity. This includes explaining the situation in which the nonconformity occurred, providing details necessary to find the evidence in the system, like for example, document numbers, dates, part numbers, etc., and providing enough detail so that a person reading the finding a year from now or further will understand exactly what happened. If there are several applicable clauses that nonconformity applies to, pick the most relevant one. No nonconformities are written against notes or before Clause 4 of ISO 1345. There are 2 types of nonconformities, major and minor. Major nonconformities affect the capability of the management system to achieve the intended results. If there is significant doubt that effective process control is in place, or that products or services will meet specified requirements, this could be a major nonconformity. When a number of minor nonconformities associated with the same requirement or issue could demonstrate a systemic failure, this could also turn into a major nonconformity. For example, multiple missing unsigned documents, multiple unauthorized alterations to documents, or multiple violations of requirements, or other problems that adversely affect processes or operations could all be examples of major nonconformities. Minor nonconformities are nonconformities that do not affect the capability of the management system to achieve the intended result. This could be a single system failure, such as a single missing or an unsigned document, any unauthorized alteration to a document, release of a purchase order without prior approval, or using an instrument after its calibration date. An effective way to finding out if a nonconformance is major or minor is to look at its frequency, detection, and impact. The following are good questions to consider. Will the problem be often repeated? Will the system detect the problem on time? What is the impact of the problem if not corrected? Observations and opportunities for improvement, or OFIs, are optional methods for noting audit findings. Observations are frequently defined as mini-findings and are slight deviations from an otherwise well-implemented process, such as a minor oversight on the part of the auditee. They are not typically serious enough to be considered minor. OFIs are suboptimal situations observed by the auditor that can't be tied directly to a requirement in the standard, but if fixed, could enhance the organization's operating efficiency. OFIs are offered for the organization's consideration based on the auditor's knowledge and experience. Also note that FDA auditors cannot review corrective action and preventive action, supplier, or management review records during an audit. And that now brings us to the end of this module. Be sure to review all applicable procedure-informed templates that Rook has related to the requirements listed in this module. When preparing documents using these templates for our clients, be sure to customize them to what the organization actually engages in for the products they make. Remember to take the Module 10 quiz. You must score at least an 80% to pass, and the quiz can be retaken as many times as needed.